today we're actually lucky to have Neil Aiton, who's one of the co-editors of the volume. Neil is going to introduce himself to you, and then he's going to talk about how does alcohol affect the developing fetus. So Neil, take it away, if you would.
Hi, thanks very much, Sandy. So I work, my normal job, if you like, is as a neonatologist. So I work down in Brighton, and the one-stop clinic where I work is a clinic for mothers and their babies when there's associated perinatal substance use. And this is how I became aware of and interested in, both from a research and a clinical perspective, in FASD and prenatal alcohol exposure. So I think to start off with, when you're thinking about a mother, a fetus, and the pregnancy, it's always very helpful to, I think, distinguish sometimes effects on all of those three things. Because very often, whenever you read about how alcohol affects the nervous system and with respect to FASD, we're thinking very much about development, and we're thinking about neurodevelopment in the future and the effects of alcohol on the nervous system. But in actual fact, I think the effects of alcohol really are much broader than that. And so I think it is important, although I put the big arrow here pointing to the central nervous system or the brain of the developing fetus, there are wider effects just on the growth and development of the fetus, as well as on other organs and on metabolism. But there's also effects on, I would call it, the pregnancy. And I know that sounds a little bit artificial to distinguish the pregnancy from the mum who is holding that pregnancy, if you like. But I think there, what I'm really alluding to is effects on things like placental function, the placental circulation, hormones, the increased likelihood of things like hypertension, which create an adverse environment for the fetus who's growing and developing during pregnancy when there's additional alcohol exposure. And of course, right at very early pregnancy, I think what's very little known is the effect of even quite low levels of alcohol consumption related to the risk of miscarriage. And there's some quite robust data from Denmark that shows that you get up to sort of 3 times the risk of first trimester miscarriage, from about 3% up to about 9 to 10%, even if you're consuming just around 5 units of alcohol per week or more. So, you know, that's not very much alcohol. If you're thinking about 5 units, that perhaps might be just a couple of glasses of wine in a whole week. And that's quite mind-blowing, really, and I think is not very much known about. But in addition, there's also 3 times the risk of premature delivery and also risks of low birth weight in the developing baby. But of course, there's also effects on the mother as well. And I'll come back to that in a little bit in a moment. And some of that can even extend a long way before the pregnancy. But during the pregnancy, effects on the mother can affect things like alcohol metabolism, nutrition, dietary cofactors, and all of those things, which can also help be protective if you have a good, well-balanced diet, to help protect you from potential damage or harm which might be caused by adverse things such as alcohol. So I think it is much wider. And so often when I'm looking at papers, research papers, or even textbooks looking at alcohol, it's just solely concentrating on the central nervous system of the fetus, but it is to make sure that people are aware that it is much wider. Of course, that is the most important thing. And here, these are MRI, constructed from 3-dimensional MRI images of the developing fetal brain. And you can see how the brain increases in complexity from just the first couple of weeks of life through to initially it's starting off just as a simple sort of spinal cord with then an outgrowth in towards the head, which is the sort of primitive central part of the brain. And as the brain becomes more complicated, by about 50 days, so that's about 7 weeks of fetal life, then you just begin to start having the development of the cerebral hemispheres starting to happen. And then after the cerebral hemispheres have developed, there begins to be more folding of the brain and more of what we see, or what I see as a neonatologist, in babies born at around 22 to 24 weeks gestation onwards, where the brain is pretty well formed and pretty normal in shape, but of course it has a massive increase in complexity to undergo during the last trimester. And I think that's really important, because that affects how we think about how alcohol might affect the developing brain. And I come back to those early pictures, if you look at the top left picture on this slide, where in a way you've got at about 3 weeks of age, after the fetus has been first after fertilization has happened, you've just got a sort of primitive spinal cord beginning to happen. And then of course the brain hasn't even got to be developed at that point. So it's difficult to understand how very early alcohol exposure would cause significant neurological harm. And quite often when I'm in the clinic and I'm talking to mums, I'm getting out that pregnancy calculator, and we're talking about, you know, when people have come and said, well, this happened and I didn't know I was pregnant. And we're often just getting out and saying, well, when exactly? Because of course, what's really important into that conversation is that although just for the last minute or two, I've been talking about fetal age, what we have to remember is that the pregnancy age is 2 weeks more than that, because we normally date a 40-week pregnancy to when the date of the last period would have been. And conception normally happens at around a couple of weeks after most mums would have had their last period. So that's why when you're looking at maps or any evidence related to the fetus, you often have to add on 2 weeks to that. So when I'm talking, if you look at the third picture along the top here, at around 49 days, when the cerebral hemispheres just start to form, so that 49 days is 7 weeks of age for the fetus. That's about 9 weeks of pregnancy. And that's interesting for me, because before that, I would say in the study that I've been involved in about nearly 400 women, looking at the effects on the face and 3D photography, we were finding that 92 to 93% of women had recognized their pregnancy before 8 weeks of age. So I think that's quite an important sort of milestone, if you like. In that early phase, the brain is just the very primitive central parts of the brain. And this is where I think these are the parts of the brain that regulate attention. They're in the center part of the brain, what we call the limbic system. So they regulate things like attention and also impulsivity. So one might think perhaps of the sort of traits that one might see in things like attention deficit disorder, if one's going to get any effect relating from very early exposure before 8 weeks into pregnancy. The second period, I think, which is helpful to think about, is when those cerebral hemispheres start developing, and then the white matter tracks between the parts of the brain begin to develop. So this is where the developing brain and connectivity is beginning to happen. And then the final stage of pregnancy, that last trimester from about sort of 24 weeks onwards, where look at that bottom last two pictures really, the one bottom right and the one next to it, where you're seeing a massive increase in the folding and complexity of the brain. And this is a period of fetal life when there's what we call neuronal migration. So these are when the nerve cells are migrating to form complex layers within the brain. And the purpose of our brain as highly developed mammals, as humans, we've got much more of that folding than animals that are not as intelligent as us as humans. So that's where, if you like, intellectual processing, cognitive function is more likely to be affected, if you like, towards those latter parts of pregnancy. But for me, that's always a very powerful reason to say to mums during pregnancy, when we're having those conversations, that it's not too late to stop. And that's a really, really important message. No, because I think I do see a lot of stuff online and discussed in groups, and I never want to see mums coming to that point, oh, well, you know, it's too late. I know I'm 12 weeks into my pregnancy, the damage is done, there's nothing I can do about it now. And I think we'll say, no, it's really, really important. So I'm going to move on a little bit, but and I'm not really going to cover today the effects on growth and also facial appearance, which are well known about. But I think it is important not to forget those things. So, as I've just said, to summarize, I like to think of it in three ways, really. The primitive central nervous system from about 3 weeks of age. Then that second stage, the developing cerebral hemispheres and interconnectivity from 7 weeks up till about 21, 22 weeks, when we're developing those connections. And then that third stage, really, of what I called increasing complexity. And then I've put the little calculator as a reminder that pregnancy is 2 weeks more advanced than fetal age. But of course, alcohol can affect things even before pregnancy happens. And I put this slide in because there is some evidence that some of this comes from the ACEs study in the United States, that we've got to remember that female fetuses they already have all of the eggs within their ovaries as an immature baby, as an immature fetus developing inside their mother. So potentially things that can impact on the mother are going to, or can have, epigenetic influences on the genetic material contained within the ovaries of a female fetus. And the ACEs study has shown that mothers who've been exposed to these things in an adverse environment during their own pregnancy, so up to 20 years or more before, can, for example, have babies themselves who are of lower birth weight than you would expect when compared with matched peers. So that's really interesting. And I think it is important for us to think about how one tries to prevent those intergenerational effects propagating. And of course, with alcohol, it can affect what I mentioned. I used the word epigenetics, and we all hear about DNA, which contains our genetic code, if you like, as to how we're going to be, our genetic makeup. But there are lots of proteins and additional things around that complex helical structure, the circular nature of DNA, that affect how genes are expressed. And these are proteins and sugars that affect what groups of genes are expressed, when they're expressed, how they're expressed, and how genes are, for example, turned off. Good example, you know, the gene that influences hair color, for example, tends to get turned off as we get older, which is why people go gray. Why is that? Who knows? but it's a good example of the fact that you've still got that gene inside your body. It hasn't changed. And I think we have begun to understand that alcohol can have these effects on genetics that can alter how genes are expressed, and that can change over time, but it can also have longer term influences. The same applies to the man, but of course slightly differently, because although the testes were present, there is a much quicker cycle, because in a woman, those ovaries are the actual eggs that were present in the fetus that then go on to develop and are issued during menstrual cycles during later life after maturity, sexual maturity. In the man, those testes are present and descend down, but in actual fact, the sperm that are made subsequently derive from those cells that are present in the testes, and so are made, and this sort of sperm generation cycle is generally around about 3 months. So men who want to avoid potentially having any effects of alcohol being propagated, and there's not much evidence for that so far, but perhaps some very subtle things beginning to emerge, but I don't want to overemphasize that, would want to avoid alcohol for about 3 months. And then I would put into the middle, moving on, the effect of alcohol on relationships, family function, and those things which we know can also cause adverse events during pregnancy. Those things can affect the fetus, and they can also affect early attachment and bonding and relationships after birth. One other factor that I think is sometimes difficult to understand and difficult to explain is the variable outcome. Why, for a certain level of alcohol consumption, can we not relate that to a particular outcome in a child? And this has always been really challenging, but in terms of a model, I think of it like a seesaw. The variability of outcome, so its adverse effects that might be caused by alcohol, are balanced by protective effects that we might have, for example. And so I think there can be variability or genetic variation in the ways we metabolize alcohol. There can be genetic variabilities in our susceptibility to damage from alcohol. There can be differences in metabolism. There can be differences in dietary intake that can affect, and things like dietary cofactors and vitamins and things like that that can affect our ability to minimize oxidative damage, for example, in our mitochondria, the little things in the cells that provide energy. And then, of course, the effects on behavioral interaction as well. So I think all of those things can explain the variability of outcome. So I think kind of probably bringing that to a sort of summary, really, I think there are many ways that a fetus can be affected during pregnancy. The mother, the pregnancy unit itself, the placental fetal unit, if you like, and the fetus. I think there is some evidence now that for babies exposed to alcohol during their prenatal period as a fetus can be wired a little bit differently as a result of that. And this can leave them less able to adapt to adverse experiences in the future. There is a little bit of evidence beginning to accumulate now that even antenatal experiences can have an impact on that. There's certainly evidence on postnatal attachment experience that you will be aware of, many of you. And as a result of that, perhaps you might just consider that resilience, our ability to respond, or think of that seesaw I showed just now, is reduced because of that different wiring. But the brain is an immensely adaptable organ and can change and develop with time, I think. And what we've, I suppose, become much more aware of in the world with children who have been affected by prenatal alcohol exposure is preventing adverse issues, creating, with that lack of or less resilience, creating further impact because of and leading to other longer term and additional issues around the primary problem. So I think that gives a lot of hope and scope for future interventions. And I think also for me as a neonatologist and for those working in the perinatal field, of the importance of keeping that awareness with people to reduce further impact. And I'll stop there.
Oh, that's great. Thank you so much, Neil. That's a lot to cover in a short period of time, but I know I've learned things from listening to you.